Good afternoon, everyone. Thank you so much for joining us here today. We're here with Dr. Grant Kofax of the Department of Public Health to provide a very important update around what's happening in San Francisco as it relates to COVID-19. As of today, the total number of cases in San Francisco are 13,139. The total hospitalizations are 36. Sadly, the total number of deaths have reached 151, and we are seeing over 5,000, almost 6,000 tests per day. Our positivity rate has went from a record low to now 1.28%. And what does all this mean? We are seeing an uptick. 2 weeks ago, we put a pause on our reopening efforts, and we made it clear to the people of San Francisco that we are seeing the number of cases increase, and we should be concerned. We had plans. We had plans to not only continue our reopening efforts, but we had plans to really expand so many services, so many businesses, and a number of other things. And sadly, 2 weeks ago, we knew we were possibly headed in this direction. And sadly, what we're seeing now today is put us in a situation that we have to take a moment and to recognize that there is a problem. The uptick that we have seen has really is really a cause for concern, which has put us in a situation where we've had to make yet another hard choice. San Francisco has been praised over the past couple of months around the number of cases, our testing capacity, and what we've been doing here locally, our positivity rate, and having the lowest number of deaths of any major city in the country. But that's only because many of you have been very cooperative and have supported the efforts that we've put forward. And unfortunately, we've been in this for a long time now, and people are tired. And so people have gotten complacent. And as a result, because of behavior, we're seeing an uptick. And as a result of that uptick, it has forced our city to make some very, very hard decisions. And not just pause the reopening efforts, but to, in fact, roll back some of the gains that we have made. So sadly, beginning the end of the day Friday, we will need to eliminate indoor dining. We will need to reduce capacity at gyms and movie theaters. We will be putting a pause on opening additional high schools. And so there are a number of things that, unfortunately, we will now need to do as a result of this. And Dr. Colfax will talk a little bit more about what that entails and the numbers specifically, and why we are at a place where we are doing something that I wish we didn't have to do. Because I understand that, especially as the weather gets colder and it's the holiday season, and as people are starting to hire back their employees and purchase food and get prepared, that this is having a tremendous impact on so many businesses, and in particular the restaurant industry in San Francisco. I understand that, people want to get back to school, and in fact, we're not providing any rollbacks on any elementary or any middle schools, because what we know about high schools, unfortunately, is the transmission rate is similar to adults, which is why we need to put a pause on reopening high schools. But it doesn't mean we shouldn't continue to move forward and make sure that we get our elementary and our middle schools open as soon as possible. And our Department of Public Health continues to stand ready to work with our public and private school systems to do just that. In fact, today we know that the Board of Education has plans to vote on a resolution to get our schools back open sooner rather than later. We are supported, and we are committed as a city to continue to work with them to do just that. This concern that we have around this uptick does not mean that we can't still move in a direction to get our schools open sooner rather than later. We also know, again, that so many of our businesses are struggling, and even though the city has provided relief in so many ways, we can't do it alone. Just recently, we put out some information around providing some additional support for our restaurants, $2.5 million in fee and tax waivers, $1 million in grants to help restaurants create a shared space programs to support outdoor dining, and we're directing part of the recently announced $3.5 million in zero-interest SF help loans towards low and moderate income residents. We know that more is needed. We can't do it alone. This is why I wholeheartedly support the Restaurant Act, HR 7197, which will establish $120 billion to support restaurants in this country. We definitely need to do more, but the fact is the virus is spreading, and we have to make the hard decisions. The good news is that we have a new president and a new vice president. And we also know that we just heard the good news yesterday that we've made progress on the vaccine. But those things aren't going to help us today with what we're seeing. They're going to help us for the future, but for now, we have to make sure that we're protecting and saving lives here in the city right now. It's a very hard thing to think about just what impact this is going to have on the people of San Francisco. When making these decisions, we don't take them lightly. We look at the science, we look at the data. We think about every single restaurant and every single school and every single business that has not collected any revenue whatsoever since this pandemic began. We understand the challenges that exist, and it's why we've continued to revamp our Jobs Now program to help pay for workers. It's why we've provided some additional resources in every way possible and deferred and even waived city fees. And we will do what we can to do as much as we can. And as I said, we can't do it alone. We're going to be counting on the decisions made in Washington to provide some additional support that could help put us in a better place. But for now, we have to do what's necessary to protect the people of San Francisco. And so when there are people who are out and not wearing their mask and not following the public health orders and doing things that sadly spreads the virus, then it causes us additional delays on our reopening efforts. When I think about what's been happening as it relates to the virus. We know that in the past we talk about the disproportionate impact specifically on the Latino community. We made a record $28 million investment to try and curb that. And the good news is we're seeing the numbers change slightly. So what we are seeing is neighborhoods that traditionally were not impacted by the virus. We're starting to see neighborhoods where people are hanging out at some of the bars and some of the places, and we're also seeing the mask come off and people who are getting comfortable and complacent. This virus definitely reacts to behavior that does not follow the suggested public health guidelines around mask wearing and social distancing. And so we know that we're going to have to change our behavior as we come upon the holiday season. We know people are going to want to get together, families and friends, and it's a little bit colder outside, so people are going to want to be indoors. And so we're going to have to think about how that's going to impact this virus and its ability to move around. The hard choices that we make now will help make things better for us in the future. It will get our city open. It will get our businesses open. It will get our kids back in school faster. So we have to continue to make the hard choices. I know that the people of this city are tired of me asking so much of you, time and time again. I've come out here and have asked you to do things that have made it very, very difficult for you in your life, whether it's taking care of your children, your elderly parent, or even going to work. But we need everyone's cooperation. We need everyone's support. We know this has not been easy. It's not been easy for so many people for so long, and we didn't think we'd be in the midst of a pandemic as long as we are. We're seeing in places like Europe where they've had to roll back their reopening efforts. We're seeing upticks all over the country, so it's not just San Francisco. And the reason why we've had better results is because we acted on data quickly. We made the hard decisions, and we did what was necessary to protect people. And so many of you have been understanding and you've cooperated. So I want to thank you for doing that, but we are asking for a lot more, I know. And as we approach the holiday season, we need everyone to be mindful as to what is at stake. Making a decision to support opening a business and then asking that business to close, it is heartbreaking. It is very, very unfortunate, but it is necessary. And the way that we make sure that this does not continue to happen is if we realize that the possibility of rolling back even more could happen if we don't change our behavior. So sadly, we are at a different place, but I'm still hopeful about the future. I'm hopeful because we're going to have a president and vice president who is already working on the COVID response and a national response around wearing masks and doing what's necessary in order to get this country through this, because even if San Francisco is doing well, it means nothing if everyone else isn't. When we think about this holiday season and people traveling and moving around more, that potentially could spread the virus. So we're asking people not to do unnecessary traveling at this time, because we really want to get this under control so that next year we're able to do exactly what we love to do during the holiday season, and that is celebrate with one another. We're asking for a lot to sacrifice so that we can get back to life as we know it. This is hard, yes, but it's necessary. And I want to thank you again for your cooperation and understanding. It is really tough to put a pause and to hold back on some of the things that we're going to need to hold back on, but it's necessary. And I hope the people of the city understand how hard this is for me to do, especially for businesses, especially for moving forward with some of the things that people were truly not only looking forward to and preparing for, but things that folks have spent money in order to prepare, and the losses related to those expenses. Those things do not go unnoticed, and we are going to do everything we can to be as supportive as we can as a city to make sure that we continue to uplift and to support our businesses and our communities and our schools and our families. It is a hard, long road, but we're going to get through this. A vaccine is inevitable, but it's not here yet. So please, thank you for your patience and your understanding, and at this time to provide clarity around the data and what it means, and to provide details specifically around what will open and what will be paused for now. The Director of the Department of Public Health, Dr. Grant Colfax.
Good afternoon. I'm Grant Colfax, Director of Health for the City and County of San Francisco. And thank you, Mayor Breed. As always, we are fortunate as a city to have your leadership and tenacity. Today, we are unfortunately taking a step back. We are taking a step back to ensure we can move forward in the future. If we take these steps today, we can mitigate the spread of the virus, and in the long run, we will be safer and stronger. But this is difficult, and it is a sacrifice. We are halting indoor dining, pausing on in-person learning at additional high schools, and reducing the capacity of some indoor activities. This is because the spread of the virus is aggressive and threatening. Let me do a deep dive to show you where we are and where we could be headed if we do not take these aggressive steps. Our cases in San Francisco have been increasing dramatically over the last month. We have seen cases increase, as shown in this slide, by 250% since early October. And in the past 2 weeks, from October 21st through November 5th, our rate has increased from 3.7 per 100,000 people to 9 per 100,000 residents. We are averaging nearly 80 new cases a day now, up from just 32 new cases at the end of October. And this is consistent, unfortunately, with what we are seeing across California and across the Bay Area region. In fact, while California still remains in much better shape in terms of case increases compared to the rest of the nation, California has seen a 29% increase in new cases over the past 2 weeks. So, where may we be headed if we do not reverse this trend? Let's go to the next slide. This shows how cases are increasing and the projection for those increases. So you can see on this slide, we are in a place where cases have recently increased dramatically. Our reproductive rate of the virus, that rate at which the virus is increasing and spreading through our community, has increased above 1, meaning cases will continue to increase dramatically in the future. As you can see, we will go up to over 300 cases a day by late December if this increase continues. A sharp, rapid increase in cases. Reproductive rate above 1. Remember, that means that the virus is rapidly spreading through our community. Let's go to the next slide. So our current rate of increase is greater than the rate of increase on the last surge. This suggests much broader virus transmission and has the potential to be explosive. The orange line here shows what happened this summer when we had that summer surge of the virus. We peaked in our cases on July 19th. But again, as this slide indicates, we are on track to exceed the surge in the summer as our current cases are shown here in blue. So that blue line represents where we've been just in the last couple of weeks, the beginning of this fall surge, October 21st to November 5th. That line is superimposed on our summer surge line, the orange line, at the beginning of that summer surge, June 15th to June 30th. The point is here is not only is that increase, this increase that we're having now in this fall surge, commensurate with the orange line, it is actually steeper. The rate is increasing even higher. This suggests that if we do not turn this around, our fall surge will exceed our summer surge. If we stay on our current course of activities, if we do not pause and we do not reverse, it is entirely plausible that we will face a situation where our healthcare system could become overwhelmed and reverse the current progress that we've made all these many months. Therefore, next slide, our action today will limit indoor activities. We will close indoor dining and bars serving food effective 11:59 this Friday, p.m. this Friday. We will also limit, can I have the next slide, please? I think there's another slide here. Yes, thank you. We will also pause the opening of additional high school and reduce capacity of fitness centers and movie theaters. Schools that are currently open will be allowed to stay open, and elementary schools and middle schools will continue to open. But for high schools that have not opened at this time, we will put a pause to see what happens in the near future to this increase in cases. We will again be watching the data, assessing day by day to determine our next steps in possible reopening or even a further restriction of activities. I also wanted to discuss the holiday season, which is quickly approaching. And we need to remember that the virus is not only still with us, but there is more around than ever before. The virus, unfortunately, has no boundaries, no limits, and unfortunately, it certainly does not have a holiday schedule. Today's announcement goes a long way in making sure that we will have a much healthier holiday season. As we move into these holiday months, we are maintaining our focus on our hospital capacity and ensuring San Franciscans can receive the care they need during this holiday season. And we want to do everything we can to avoid reinstating a shelter-in-place order that would unfortunately shut our city down for the holidays. And even if we beat back the rapid and aggressive spread of COVID-19 that is currently racing through our city, we must continue to act with caution and diligence during this holiday season. This means following the principles and guidelines I have been sharing with all of you since the beginning of the COVID-19 response. And I know that these messages can feel repetitive, but they continue to remain the most important tools we have to beat back the virus. We know how to beat back this virus, San Francisco. We've done it twice. Let's come together, dig deeper, and do it a third time. For the holidays, our guidance includes the following. Travel outside the Bay Area will increase your chance of getting infected with the virus and spreading it to others upon your return. Non-essential travel, including holiday travel, is not recommended. Additional precautions must be taken when hosting and interacting with people who are traveling to the Bay Area, especially from other communities with widespread COVID-19. Wear a face mask and stay 6 feet from people outside your immediate household, and that includes family members who are not in your immediate household. Eating and drinking together is higher risk because people must take off their masks to eat and drink. People are often relaxed about social distancing, while eating and talking create more respiratory droplets. Please have that holiday dinner in person only with those you live with. Join your loved ones elsewhere on Zoom on Teams, on the phone. This is not the year to pull together a big holiday table with multiple households, multiple members of your family indoors, potentially spreading the virus to your loved ones. If you do have a holiday dinner or gathering, please, it must be outside. People must stay 6 feet apart and wear masks. And please, use caution when actively eating or drinking. Now I know this is not how I imagine this holiday season. But unfortunately, it is the holiday season we need to have this year to truly show people that we care and to show and protect the people we love how to keep ourselves, our families, our friends, our communities safe. We need to protect our aging parents or grandparents. And this can only happen with caution and diligence that includes that masking, that good hygiene, and that limited time of social interactions. But everyone needs to do their part, and everyone needs to act with caution and care. We will get through this together. And I continue to thank all of you in San Francisco for doing your part. Thank you.
At this time, we have a few health-related questions for you when you are ready. The first set of questions are from Alex Barrera from SF Business Times. Are the activities that are being impacted today indicative of new positive cases being attributed to those activities?
So we have taken a pause in reversed activities that we know based on the data, science, and facts that are most risky. We know a lot now about how this virus is transmitted. We know that the virus is more likely to be transmitted indoors, particularly during activities where people take their mask off. So that the decision, the difficult decision that we have made today is based on the data that we know how this virus is spread and that those activities increase the risk. We also know that there's much more likely the virus is more likely to be transmitted in very large groups or gatherings, which is another reason that we reduced the capacity of the gatherings today.
Thank you. For the next question comes from Gerald Chin, San Francisco Bay. Does the city expect the state to put the San Francisco back in strict tier?
So what we're responding to right now are the data and the local data that we have. And as you saw, we're looking at the really recent data. I just showed those slides. We're going to continue to watch the state. We do expect the state will shift us to another tier, but we need to move fast here. We need to look at our local information, and that's why we're responding so quickly right here. You saw that rate of increase. That rate is very concerning, particularly given the fact that it exceeds the rate of increase we saw at the beginning of that summer surge. So we have to act now to turn the tide on this fall surge.
There are no further questions. And this concludes the press conference. Thank you, Mayor Breed and Dr. Gold.